Perfect. Good morning, everyone. I'm really happy to see all of you here. There's actually a lot of attendees, so it's great to see how much interest there is in mental health and in the European Mental Health Week, which this event is a part of. It is a pan-European initiative, so it's organized by people from all over Europe to raise awareness about the importance of mental health in our everyday lives. And it's set up and run by Mental Health Europe. And this year's edition is themed Better Together, Co-Creating the Future of Mental Health. What does that mean? It's a bit of a term that might not make sense to everyone immediately. Co-creation is an approach where policy and practice in mental health care actually focuses on the real needs of people, of patients, of those who have mental health issues. And it mostly focuses on sharing the responsibility and sharing the accountability of mental health care, which means that people with lived experience, like myself, I was diagnosed with bipolar disorder and I was hospitalized when I was 20. And it was not an amazing experience. I couldn't really have a say in my treatment or in my stay at the hospital. And like many other people, that kind of drove me to be a bit more vocal about mental health care and the way that patients are treated and the way that patients have input in how they are treated. So now that I've recovered, I started advocating for a lot more inclusive and holistic psychiatric care, where patients and experts both come together to create policy and practice that actually works, which is the thing that this webinar focuses on the shared creation and the shared development of mental health care and mental health policy as well. It's also a great opportunity to reflect on the developments of the EU's comprehensive approach to mental health, which was adopted by the European Commission less than a year ago, and it had started already to deliver on some of its promises, which is great to see. So you'll hear more about that. If you have any thoughts throughout the webinar or anything you would like to say, of course, you can say so in the chat. If you have anything that you would like to say about the webinar online, on Twitter, you can use the hashtag European Mental Health Week. And at the end, we'll be taking questions. We will have a little discussion and a Q&A after all the presentations. But you can also put your questions in the chat throughout, and I will keep an eye on them, and we'll get to them later. So first, we're hearing from the host, the European Commission, to talk about what is happening with this EU comprehensive approach to mental health. So for that, I'm giving the floor to Stefan Schreck. He's an advisor for the stakeholder relations at the Directorate for Health and Food Safety. Stefan, you have the floor.
Thank you, Belle. Dear ladies and gentlemen, colleagues, friends, I'm delighted to be here with you today on the occasion of European Mental Health Week. Mental health concerns each and every one of us. Already before the COVID-19 pandemic, 1 in 6 people in the European Union suffered from mental health issues at a cost of 4% of GDP. The past years have not been easy for EU citizens. A series of challenges have disrupted their daily lives. The COVID-19 pandemic, Russia's war of aggression in Ukraine, rising living costs, and climate change, all of these have worsened mental health problems. As in almost all crises, vulnerable groups such as children, young people, the elderly, and those with pre-existing mental health conditions suffer the most. In young people, suicide remains the second leading cause of death. A recent Eurobarometer on mental health showed that almost half of the respondents had an emotional or psychosocial problem in the last 12 months. At the same time, the vast majority of citizens view mental health promotion as important as physical health promotion. Last June, the Commission presented a communication setting out Europe's first truly comprehensive approach to mental health. It was developed following a series of consultations with member states, stakeholders, citizens, and Commission services, which took place in spring 2023. The communication on a comprehensive approach to mental health is a pillar of the European Health Union. The communication is based on the right of everyone to timely access to affordable, preventive, and curative care of good quality as one of the principles of the European Pillar of Social Rights. It emphasizes the need to protect and promote the rights of individuals with mental health problems and promotes equality and empowerment for those who need help. This comprehensive approach to mental health calls upon national and regional actors, health and non-health policy sectors, and relevant stakeholders such as patient organizations, civil society organizations to work together. Through its flagship initiatives, it will support action by all actors by putting the necessary tools in place. Let me highlight the steps taken so far in delivering its flagship initiative. Flagship 1, the European Mental Health Capacity Building Initiative, was launched to support member states in adopting a mental health across policies approach. Through this initiative, worth 11 million euros, the Commission, together with WHO, is providing tailored support to member states to develop and deliver mental health systems and services. In addition, the Commission has made available 10 million euros to support the role of stakeholders in promoting mental health in communities, focusing on vulnerable groups, including children and young people living in deprived areas, and migrant and/or refugee populations. So far, 6 projects addressing the transfer of best practices on mental health have been launched. The Commission has funded a multidisciplinary training and exchange program on mental health worth 9 million euros. The project, EU Pro Mens, will take place across 30 participating countries to foster collaboration and knowledge sharing, including the co-creation of an inclusion of people with lived experience. To achieve the objective of promoting good mental health, prevention and early intervention for mental health problems, the Commission is supporting member states in the development and implementation of depression and suicide prevention policies based on exchange of best practices. The Commission has created a new EU repository on mental health best and promising practices on the EU Best Practice Portal. These 29 practices were presented to member states in a marketplace event for potential transfer at national level. With funding of 6 million euros, the Commission is supporting collaborative action between member states. This joint action, called Mentor, will include the transfer and rollout of best and promising practices and will promote mental health in vulnerable groups as well as tackle stigma on mental health. A number of projects with EU funding of around 4 million euros under the EU for Health programme will be implemented by stakeholders. These target vulnerable groups such as migrants, refugees, and displaced people from Ukraine. The communication aims to boost the mental health of children and young people as a vulnerable group of the population. We will develop a prevention toolkit for a comprehensive prevention-oriented approach to children's health, together with UNICEF. This will focus on addressing the links between mental and physical health and determinants. We will ensure the participation of young people in the development of this toolkit. The creation of a child and youth mental health network will allow the exchange of information and mutual support between children. We are implementing the Better Internet for Kids strategy and its knowledge hub to better protect children in the digital world. We will develop an EU guidance document on stigma and continue to raise awareness in the fight against stigma, together with member states and the expert group on public health. A workshop led by WHO will be organized next week, 22nd and 23rd of May 2024, to support this collaboration action. In October, a multi-channel campaign addressing stigma and discrimination will be launched to coincide with World Mental Health Day. To ensure its success, we will collaborate with relevant stakeholders in order to co-create with everyone involved. The Commission is supporting the collection of data and information on mental health to better understand the mental health situation in the EU. As of 2025, the European Health Interview Survey will include additional data on mental health to measure the level of subjective well-being in the population. In 2027, the EU survey gathering data on income and living conditions will include a module on mental health to support the monitoring and assessment of progress on mental health across the European Union. Finally, the Commission is fostering mental health globally. It is providing psychological first aid to people affected by the Russian war of aggression against Ukraine, together with the Red Cross. Around 30 million euros have been available for this support. So thank you very much.
Great, thank you so much. It's good to see the details of the Commission's comprehensive approach to mental health. Now, I would like to welcome the other co-organizers of this webinar, which are Mental Health Europe and WHO Europe, who will dive deeper into the topic of co-creating to improve mental health. So first, let me give the floor to Francesca Gentola, a Policy and Knowledge Officer for Mental Health Europe. She joined Mental Health Europe in January 2022, and she's a passionate advocate for the right to health, which of course includes mental health. Francesca, can you explain this concept of co-creation we're talking about in more detail and explain why Mental Health Europe chose this topic for today's webinar and this week of mental health?
Thank you, Belle, and good morning, everybody. It's a pleasure to be here with you in occasion of the 5th edition of European Mental Health Week. As Belle was saying, this year the topic is Better Together, Co-Creating the Future of Mental Health. Why did we choose this theme? Well, we noticed that our societies are facing pressing challenges. There is, as Stefan was explaining, an increase in mental health problems across the population, and the mental health needs remain largely unmet. So we believe that our societies cannot keep on doing business as usual. There is a need for a wide-ranging transformation. And we believe that co-creation can be a path to transformation towards societies that are based on collaboration, partnership, and true understanding of needs. And this will bring us closer to our vision, which is a Europe where everybody's mental health can flourish across their life course. Now it would be appropriate to go more into details of what exactly we mean when we talk about co-creation. So the Mental Health Europe defines co-creation as a collaborative approach involving all actors in mental health working together on an equal basis to develop and implement policies, services, research, communication that foster positive mental health, and this in line with the human rights and psychosocial model of understanding mental health. Now, the key element here is not simply having different actors around the table. It's about redistributing the power and giving equal value to all the actors that are involved in the process. And this is very powerful in the mental health field because traditionally power has been held by some groups. And for instance, people with lived experience have lacked the possibility for their voice to be heard. And then let me stress that we call for co-creation in relation to policy, research, services, communication in every step of the process. So design, but also implementation, evaluation. And also for Mental Health Europe, co-creation should and can be applied not just in relation to mental health care and mental health care provision, but also in prevention of mental health problems and in promotion of good mental health across the population. And then to link with the communication by the Commission on a comprehensive approach to mental health, it's clearly stressed, and the rationale of the communication is that the obstacles to good mental health cannot be overcome exclusively within the health system. What we need is a comprehensive approach. We need mental health in all policies, and this is a key element when we call for co-creation, because we say that this has to happen in line with the psychosocial model of mental health, which means that when we reflect on who are the stakeholders that needs to be engaged in the co-creation process, we need to look beyond health, and we need to consider stakeholders from policies such as environment, digitalization, housing, all policies that have an impact on mental health. And so these stakeholders have to be part of the co-creation process. Now, in terms of how to apply co-creation in practice, there is no one size that fits all, because the concept is so broad and can be declined in very different ways. But the important aspect is for 7 principles of co-creation to be fulfilled. Otherwise, we risk that we are doing tokenism and ticking box exercises. These principles are inclusivity, equality, respect, reciprocity, power sharing, accessibility, and transparency. I will spend few words just about the first one because it's key. So when we decide who has to be engaged in the process of co-creation, it's important to keep diversity in mind. So for instance, if we want to invite people with lived experience, it's important to consider that this is not an homogeneous group. So depending on what we are co-creating, we may want to reach out to some and not to other. And also it's important to consider intersectionality and the diversity of people around the table. So if we want to promote good mental health for young people, we should ensure that around the table there are young people who are of different gender, different socioeconomic background or migrant origin, and so on. And this is just a few words about the first principles, but you will find all the details about each of the principles in the resources that I will refer to in a while. Now I will suggest to focus on why do we need co-creation in mental health. And here the answer is, first of all, because of human rights issues. In the case of people with lived experience, the United Nations Convention on the Right of People with Disabilities clearly states that they have the right to be meaningfully engaged in every decision that has an impact on them. And this is the principle of the nothing about us without us, which is now a cornerstone of international human rights law. But Mental Health Europe believes that if empowerment of people with lived experience is key, a key success factor in co-creation, we have to go beyond empowerment of people with lived experience and empower all the actors around the table to work with people with lived experience and to work with each other. And also for these other actors, there is a human rights argument. It's the right to participation in decision that has an impact on them, and this is related to the original meaning of co-creation, the doing things with citizens and not for them. If the human rights argument is the main one for us, it's also true that co-creation brings benefit to all those involved. First of all, to ensure that everybody is welcome at the table, co-creation removes the labels. There are no more service users, service professional, policymakers around the table. There are people with the assets and expertise that they bring in as human beings. And what happened, we can say that co-creation is a journey of discovery and growth. And the change during this journey is more important than the outcome. Because during the process of co-creation, the labels, prefabricated identities, preconception, they are challenged and removed. And this is powerful in mental health because in mental health, there is still a lot of stigma. And also in this way, co-creation can enable egalitarian relationship in our societies. Another benefit is that co-creation allows the encounter of different sets of knowledge that comes together and create new knowledge. And in this sense, co-creation can foster innovation. And so when we talk about innovation in mental health, we often think of digital technologies, but what if the real innovation was not the digital, but rather the social innovation? And here the potential of co-creation is huge, because co-creation puts everybody around the table, and the difference of perspective can ensure that we find the innovative solution to complex issues. And finally, just because of the time, not because this is the last benefit of co-creation, co-creation ensure a continuous focus and alignment with real needs on the ground. And this is key to have effective policies and practices. Now, we are aware that there are barriers in in applying co-creation in mental health. These barriers can be lack of commitment, lack of infrastructure, lack of resources, and also a culture that is very much us versus them and is not conducive to co-creation. But we want to be positive and we offer solution. So whoever in the audience you are, whether you are a policymaker or a professional working on the ground, we have a resource for you. So at this page dedicated to co-creation, you can find a policy brief on how to pave the way for co-creation, as well as practical tools on how to apply co-creation on the ground, such as guidelines and toolkit. So really, my call for action for all of you in the audience is that if you share our vision of a Europe where everybody can fully enjoy their human rights, then please engage with us during this week and beyond. And remember that together we are better. Thank you.
Thank you, Francesca. That was a great insight into what it actually means to co-create in mental health and mental health policy. Now I'd like to turn to the World Health Organization and Dr. Lydia Lazari. She is the Regional Advisor for Mental Health at the WHO Regional Office for Europe, where she's leading their work on mental health in several areas, such as policy and services, but also rights and advocacy. And she's implementing the WHO European Framework for Action in Mental Health from 2021 to 2025, which supports the Pan-European Mental Health Coalition as well. Dr. Lazari, what is your view on co-creation, and do you have any practical examples of how you are applying this in your work at WHO?
Thank you very much for this, and I think we need to start. I need to start by acknowledging, by calling to the audience to acknowledge the importance of this moment. I think we have gone a very long way. This would not have been possible. This activity about co-creation would not have been possible only until a few years ago. So the fact that we are here today to share with European audiences the importance of co-creation, the ways how to co-create, and the practical implementation, the practical values of co-creation, we should not take it for granted and acknowledge the great work of so many actors that have been around the table in the last few years to make this possible. And again, a big congratulations to Mental Health Europe for having taken this ahead and for having published a very useful resource about guiding countries, guiding partners, guiding individuals about how to involve into co-creation. I'd like to also add by like our perspective on co-creation is that first, if it is a right, it is a right of everybody that is involved to any extent to the design of policies and services that concern their lives. They have the right to be very heavily involved into and having a say and having an impact on how policies and services are designed around them. And this is true in mental health, and this is true in any other area, be that education, be that housing, be that employment. But in mental health, it is even more important because of the centuries-old stigma and discrimination against persons with lived experience that have pushed people who live with a mental health condition at the margins of the society. So this is the first point is they're right. But the second point is the evidence. We now know after years of having practicing co-creation in selected areas of Europe and the world, and I say selected because there are still areas in our region where co-creation is not yet there, but where it has happened, there is evidence that shows things go better. There are better outcomes, there are better health outcomes for the health status of the individual, and as a result there are better public health outcomes and better also service outcomes for all. So it's in the interest of all to embark into co-creation, not only from a human rights perspective, but also from a very practical perspective of having better outcomes to the investment, better return to the investment that everybody is putting into mental health policies and services. And then I would like to go into another point that is through a survey that we have conducted in frame of a collaboration with the European Commission on mental health systems capacity of the EU member states and Iceland and Norway. We learned a number of that there is unanimity among our member states on the enabling factors for implementation of mental health policies. And I'd like to list them here because they are very eye-opening. The first one is the importance of intersectoral collaboration. So everybody admits that when better together, what Francesca ended her presentation, and better together here is not only relevant into together between service providers and service recipients, but also in between different sectors. The second is community engagement. So countries recognize that an enabling factors to making policies better implemented is the engagement of communities. And then when we talk about engagement of communities, we refer to communities at large. But then there is a third point that is very relevant to the topic we are discussing here today, that is the strong buy-in by persons with lived experience, by their families, by carers. So this is where we come to a realization that our member states, our countries do know that when the policies and then when the services are bought in, when there is trust by the persons with lived experience into the policies and services, then there is a better implementation, there is a better chance of success. That in a way confirms what I was trying to say before, that co-creation is better for better health outcomes. And the fourth point that is probably less relevant to this discussion, but it's a strong advocacy point, is good budget allocations. Now, how countries do allocate their budgets, it's very important about how their policies are implemented. And that then brings me to the next point of how we are addressing this on the basis of what we learned through that survey that I just mentioned. We are having policy dialogues with countries, and it is very interesting to see that in some countries, with the EU member states, that in some countries where we do engage in those policy dialogues, we have a very strong presence of persons with lived experience and civil society organizations. But this is not even. So this also, I want to evoke what I said at the beginning. It's not for granted. So we have reached this moment when, as a European mental health community, we are very strongly advocating for co-creation, but we also have to acknowledge that the co-creation in practice is not even and is not for granted, as in is not happening everywhere. We just had a policy dialogue with Finland today, and it was a joy to see the involvement of persons with lived experience and civil society organizations sitting around the table at a very equal level and with a very equal power as the representatives of government the government, and had an equal say about how services and how mental health plans should be shaped for future work. What is then WHO doing in addition to working together with Mental Health Europe in this event, and to working together with the Commission? We are also developing an anti-stigma toolkit. So this following the launch, the publication of the Lancet Commission on Ending Stigma and Discrimination in October 2022, we are working with a very diverse group of stakeholders that include persons with lived experience into developing this anti-stigma toolkit that should be a resource at the hands of everybody that feels responsible, feels interested, feels engaged, feels intrigued, and feels they have a voice into shaping mental health policies and services. This toolkit will be consulted next week. Stefan Schreck just mentioned the meeting in Brussels that we'll have next week as a cross-learning event between the WHO Pan-European Mental Health Coalition and the EU Joint Action on Mental Health, Implemental, where we'll have an exchange of experiences, and the toolkit that I just mentioned will be put on the table for the meeting participants to be able to comment, to be able to object, to be able to contribute, so that the toolkit is strongly bought in by those who the toolkit is being developed for. And in terms of, at another level, we are also developing a leadership program, a mental health leadership program. And the novelty in that, because you might wonder, someone might wonder in the audience, what's new in that? And the novelty is that when we talk about leadership, very often in people's mind, it's policymakers, it's people who hold power, who hold responsibilities at government levels. But the leadership program is not only meant to government levels, it's not only meant to leaders of mental health services, it's meant to also civil society organization leaders, but it's also meant to individuals that, as I said before, have an interest and a voice to contribute to the shaping of mental health policies and services. So I'd like to close by saying that we will have this meeting next week. The meeting is, the participation in person is to selected participants of the Mental Health Coalition and the Joint Action Implemental who are interested in the topics of the meeting, but the meeting will be web streamed. So follow the WHO channels, please, to understand how you can follow that meeting, and you can follow the discussions of the European mental health community on areas such as co-creation, stigma, mental health service transformation, and more. Thank you, and over to you, Belle.
Thank you so much, Lydia. And it's really great to hear how people with lived experience and civil society as well are actively reached out to and involved. And it's more than just saying, look, we're co-creating, you're actually putting it in practice. I hope it's going to be more like that everywhere, like in Finland. Also, for everyone attending, remember that these discussions or these presentations will be part of the discussion we're having later. So I see there's a lot of you. Feel free to drop your questions in the chat, and then we can ask them at the end of the presentations. Next, we're going to hear from Carl Adrian Lavaux. He is a policy, projects, and EU liaison officer from the Global Alliance of Mental Illness Advocacy Networks in Europe, which is also known as GAMIAN Europe. GAMIAN has been doing advocacy work on AI during the European Mental Health Week, together with people with lived experience. And Carl will tell us more about the Insight AI Illuminating Technologies Biases in Mental Health project. So yes, Carl, over to you. Let us know what you want to achieve with this and what the project is all about.
Great, thank you very much, Belle, and thank you to all the other speakers, and of course a big thank you to Mental Health Europe and the European Commission for organising all this. So very quickly, we decided this week for the European mental health to have a look exactly at that, at the potential fact that AI is stigmatizing mental health. But before I go into that, I'll just do a quick introduction of who GAMIAN is. So GAMIAN Europe, basically we're a pan-European coalition of patient organizations founded back in 1998, yep. And we have about over 50 members in 26 countries across Europe. We work in 3 different streams, and those streams are advocacy, so at EU level, so advocating the institutions, through research projects, so that's kind of EU research projects and other projects. And the big thing that we're doing there is exactly as Francesca said, so the co-creation, so making sure that patients or people with lived experience voices in research are being held and are being, it's not just a sort of rubber stamp as it may have been in the past. And finally, we do things such as awareness raising and education projects, of which the project today, which I'm going to explain to you, is about. So without further ado, let's have a look at the project. Basically, the idea that we decided to do was that we created 4 videos for 4 different individuals living with different various mental health conditions, and basically we asked AI to generate beforehand with these videos to generate a photo of someone living with this mental health condition. So for example, we say to AI, can you please generate me someone with depression? We did depression, anxiety disorder, schizophrenia, and bipolar. And just for reference, the tools that we used, I'm sure everyone's very aware of ChatGPT. And another one called Midjourney, which is an AI sort of text to image generator. Just very quickly to make sure that we're kind of all on the same page, because it's a relatively sort of new technology. So how does basically AI image generation work? Well, in a nutshell, if you think of a baby or someone who's never known anything learning things, for example, what a car is, it learns from examples of what is that thing and what is not that thing. So AI basically looks over the internet and it looks at hundreds and thousands and millions and trillions of images, and it says, this is a car, this is not a car, this isn't a car, this is not a car, and so on and so forth, until it basically has an idea of what a certain object is. Now, when it comes to actual image generation, there are two of these AIs. So there's one that adjudicates or judges what a certain object is, and there's another one that actually generates the object. So if we have a look at it, for example, if I wanted to create a flying car, so you'd have the creator AI that tries to create something, and then you'd have the judge AI saying, nope, that's just noise, 0 out of 10, please try again. Then you've got the next one, you see, okay, it's kind of looking like a flying car, but not really, 3 out of 10, let's build on that, let's reiterate. And then finally, you've got, okay, yeah, that's kind of a flying car. That's good enough. Let's go with that. So just to give you an idea of how these sorts of things work, it's really just reflecting what's out there. So for our particular project, as I sort of stated before, we asked the AI tools to come up, and we basically, I think the thing that is kind of important is we were using really standard prompts. We weren't saying anything more than design me someone living with, and then you insert the mental health condition. So just to let you know, in the next 4 photos or the next 4 slides are going to be the designs of the people living with these, or what AI thought someone living with this condition is like. So just FYI. So first of all, we had the one for depression. As you can see, there we are. We have someone sort of crouched on the floor with light coming in, and they look like they may be in a cell. For the second one, we have bipolar. And again, we just asked AI simply draw someone with bipolar, and this was the outcome. For the third one, we said, can you please design someone living with anxiety disorder? And as you can see, this is what ended up coming out. And finally, we asked someone to draw someone with schizophrenia. And here you can actually see it's just sort of someone whose head is exploding. So basically, very quickly, you can sort of see the reactions here. These are the experts by experience. It was really interesting for us, I think, to see a real mix of reactions, from sort of amazement to honestly some not being that surprised to other people almost laughing at it, which kind of, I think, sums up exactly what we were looking for. Now, what are the key points to this project, and what was the kind of the overall idea that we wanted to do with this project? Well, I think the key point for us for this particular project is seeing that if you are able to write sort of with these very standard prompts, this is what you write in, and that's what you get out. You've got a huge risk of perpetrating or increasing stigma or bias within society. The big thing that seemed to come across, particularly with these AI, is that it focuses on really the negative bias of what's out there. And like I stated before, it's simply sort of reflecting what's out there. These AI tools don't necessarily think for themselves, but what we kind of came up with after this is, therefore, we really need to make sure that when these AI tools are being trained, there needs to be carefully thought out interventions. Otherwise, the risk of stigma that's spread via these AI depictions, particularly to people in society who maybe don't know so much about these mental health conditions, is really, really quite bad. So that was one of the kind of main points that we came across, and it was one of the main points that our experts by experience were sort of saying towards us. By the way, I'd highly recommend that you do check out the full videos on our social media. We don't unfortunately have time to go into all of it here, but just as an FYI. Secondly, and it's fantastic actually that we do have Dr. Lydia Lazari here from the WHO, because what was really interesting is we found that the poor data sets and the mental health actual info available is probably partially what is fueling these sorts of things. So it was interesting, back, and I saw, and I think it was February in 2023, maybe, the WHO released a paper basically talking about the unbalanced nature of AI mental health research, amongst other things. And also one of our members, one of Gambian Europe's members from Wales, Adferiad, which is a mental health charity, basically held another kind of data study, and they found out that there were major issues with both inadequate development understanding of mental health services, and more to the point, maybe a lack of current access to representative data sets to train AI. And I think that's where a lot of the stigmatization is coming from. Finally, and very apt to this, I think real co-creation is what's so important here. And when we're talking about it, we're going back to what Francesca was saying, we're going back to what Lydia was saying, all these sorts of things. You need all parties involved when you are training, particularly these AI algorithms, excuse me. And so this means actually people, the companies, so for example, OpenAI, Google, Midjourney, all these sort of people, making sure that there are people with lived experience all the way through, and that these are being trained on robust, accurate data sets. So finally, kind of the next steps. What are the next steps? Well, what we discussed potentially here at GAMI in Europe is creating a joint statement also with other mental health organizations and other key stakeholders, and actually sending it out to these AI developers. So like I said, for OpenAI, who run ChatGPT, to Google, to Microsoft, to Midjourney, anyone else, and explaining, sort of showcasing this, as well as other papers that have already kind of showcased this, and basically letting them know that this isn't important, this isn't going away, and the actual real potential of someone potentially in the future simply Googling an AI image of what does someone look like with schizophrenia and something similar to what we had before coming up. Also, another a big thing that we believe is super important is also advocating the different EU institutions on the importance of available, accurate, and robust data to which these AI need to be trained on. And so we're going to make sure that we're bringing that up in all of the sort of advocacy work that we're doing from now on, because otherwise, I think without these sorts of things, you really do, and I can't sort of underestimate, you do really risk, particularly as I said before, for people who don't know too much about mental health conditions in society, really getting a completely wrong image of what people with these conditions are actually like. So that's all from me. Thank you so much for the opportunity. It was very quick. I would have loved to, explain more, but I highly recommend go to our social media channels, check out the videos, and if you have any questions, of course, feel free to reach out to me. My email's there. And thank you very much again. Back to you, Belle.
Thank you so much for that. I think it says a lot, right, about kind of the ideas that are out there, and the stigma that is out there. It's also one of the reasons, actually, like I was looking at the bipolar one, right, because I've been diagnosed with bipolar, and I can see where it comes from. It makes some sense. It's also quite funny. And this is also one of the reasons I started to advocate a lot more, because if you ask AI for a person living with a mental illness or disorder, it should be a normal looking person. Like, we all look like this, right? Like, we're all humans. It's not like it makes you have some external symptoms that turn you into some sort of person with a tree coming from their brain. So yeah, that's really interesting to look, and glad there's work being done on this. So for the next half an hour, we're actually going to hear about more inspiring projects. And first up, we have Emilia Öberg, who will talk about a project that is dedicated to providing psychosocial support for promoting mental health and well-being among adolescent young carers in Europe. She's a PhD student in health science at the Linnaeus University, at the Faculty of Health and Life Sciences and the Health and Caring Science Department in Sweden. So over to you, Emilia.
Thank you very much, Belle. I need to be assigned as a presenter so I can share my screen. There we go. Yes, thank you very much, Belle, and thank you to everyone attending, as well as the other speakers and the organizers of this webinar. As Belle just said, I am a PhD student at Linnaeus University in Health Science. I'm also in charge of a support service for children as next of kin at the Swedish Red Cross Treatment Center for persons affected by war and torture in Skövde, Sweden, where we have actually implemented the MIMI model, which I will speak a little bit about today. And the MIMI model has co-creation as its very foundation. The subtitle of this talk is Increasing Mental Health and Understanding, Awareness and Acceptance Together. And oh, can't seem to change this slide. Let me see. There we go. So the MIMI project was the first major cross-national research project to focus on promoting the mental health and well-being of a largely understudied group of young carers, namely adolescent young carers. Adolescent young carers are defined as young carers who are aged between 15 and 17 years old. It was funded by the European Union's Horizon 2020 Research and Innovation Project, and it started in January 2018 and finished in June 2021. The partner countries were Sweden, the Netherlands, Italy, UK, Slovenia, and Switzerland. And as you can see, the aim was to reduce the risk factors of being an adolescent young carer by empowering the young carers with improved resilience and enhanced social support from family, schools, peers, and services. In our project, we refer to Sol Becker's definition of young carers as children and young people under the age of 18 who provide or intend to provide care, assistance, or support to a family member or a friend who has a chronic illness, disability, frailty, or addiction. They carry out significant or substantial caring tasks, often on a regular basis, and assume a level of responsibility which would usually be associated with an adult. Whilst the number of studies is increasing in the field of young carers, there is a lack of empirical research focusing specifically on adolescent young carers. And in the EU MIWI research project, we chose to focus on adolescent young carers as we recognize that they are in a key transitional phase, moving from childhood to adulthood. We also recognize that adolescent young carers particularly remain all too often invisible to policymakers and service providers. We also recognize that while there are some positive aspects relating to caring, or some positive outcomes perhaps, such as higher self-esteem or increased empathy or maturity, we also must recognize that there are challenges associated with it. It's difficult for young carers to reconcile the challenges of adolescent life with caring responsibilities. Indeed, the pressures associated with caring are considered a risk factor for mental ill health. And caring can also have a negative impact on young carers' education in the form of underachievement, absence, and dropouts, which in turn can lead to lower educational attainment and lower employability. Young carers may have less time for personal development and leisure, and they can also become victims of social stigma and bullying, which can further increase their social exclusion. The EU MIWI project had 3 objectives, the first of which was to gather knowledge on adolescent young carers by identifying their profiles, needs, and preferences, analyzing national policy, legal, and service frameworks, reviewing good practices, social innovations, and evidence. The second objective, which is what I will focus on during the rest of this presentation, was to co-create, develop, and test together with adolescent young carers a primary prevention psychosocial intervention. And the third objective was to widely disseminate the findings of the project in order to raise awareness and carry out advocacy work. The second outcome of the project resulted in the MIWI model, which provides support and opportunities for learning for young carers in order to strengthen their resilience. The MIWI model is based on DNAV, which has its roots in acceptance commitment therapy and positive psychology. The MIWI model, the DNA in the DNAV model are skills that we can use to go in the directions of our values, which is the V. The D stands for discover, which is our ability to try new things, to explore ourselves and the world. N is for noticer, our ability to be present, pay attention, and notice things. A is for the advisor, which is the inner voice in our heads, which judges what we do and who we are. And V is, as I said, for values, which are those things that are important to us and which give us meaning and energy. In the MIWI groups, we learn about our DNA skills. And through these, we aim to strengthen the adolescent young carers. We provide them with tools to handle difficult thoughts, get in contact with and notice their own feelings, find meaningfulness in strength and energy, develop flexible self-image, and build strong social networks. A MIWI group consists, a MIWI program consists of 7 group sessions, which are about 2 hours each, preferably about 1 session a week, and a follow-up session after 3 months. They can be conducted online or face-to-face, and should consist of 3 to 10 adolescent young carers and 2 group leaders. Groups are for all young carers, aged 15 to 17 years. It doesn't matter who they care for or the reason that they care for somebody. There's also a mobile app which contains information for young carers as well as exercises related to the groups. It's available in the languages of the 6 partner countries. One of the methods used throughout the research project is called blended learning networks, or BLNs for short. BLNs are mixed communities of practice, and in our project they consist of young carers themselves, former young carers, together with key stakeholders such as school staff, youth workers, health and social care professionals, members of civil societies, together with MIWI researchers. For the duration of the MIWI project, they met in each partner country about every 8 to 12 weeks for a couple of hours, plus time for fika, which you might know is very important in Sweden. And the meetings were initially face-to-face, but increasingly due to the COVID-19 pandemic, they were held online. In the BLN session, we listen, learn, and share our knowledge and experience together about the situations of young carers and the issues facing them. Members have helped in co-creating the MIWI model, and especially in creating the mobile app, which acts as a support in the MIWI model. And they have given invaluable feedback on the project results and the evaluation. More recently, members have been working together on country sustainability plans for how to best exploit, disseminate, and work with the main outputs of the project after it officially ended. Oh, sorry, that was too far. So where does the MIWI project stand today? In Sweden, several local authorities and NGOs have taken part in the MIWI training program and are currently carrying out or planning to carry out MIWI groups. To this date, 13 MIWI groups have been carried out and a total of 48 young carers have taken part. The group leaders continue to meet in online BLNs in order to continue to learn from each other's experiences of planning and delivering the MIWI program. However, the knowledge garnered during the MIWI research project showed that 1/3 of young carers have been performing care for as long as they can remember. This showed that there is a need to focus also on younger children who are providing care to an next of kin or friend. And so the Young Kin project was created, which is the project in which my PhD is situated. It aims to promote the mental health and well-being of young carers aged 12 to 15 years by continuing to gather knowledge on this under-researched group, as well as adapting the MIWI model to suit a younger age group. To do this, we have created 2 blended learning networks, one for young carers themselves and one for adult stakeholders and former young carers. Each group meets 4 to 6 times per year. The group for the young carers, they meet face-to-face. They already know each other because they have previously taken part in the MIWI group. But the adult BLN meet online, and that is because we want to include stakeholders who live in a variety of different situations. And so we have members who live in cities and some who live in smaller towns or even in rural areas.
Perfect. Can I ask you to round up so we have time for the discussion?
I'm almost finished. This is the last slide. As Francesca mentioned also in her presentation, the most important message that the adolescent young carers were a part of, who were part of the MIWI project, want others to know is nothing about us without us. They are themselves experts on their own situation and they want to be involved. If you want to know more, I can happily tell you a lot more. But you're first welcome to contact Elizabeth Hansen, who is the principal investigator in the EU MIWI project, as well as a professor at Linnaeus University, or visit the website where you can find other contact details. Thank you, and back to you, Belle.
Thank you so much. It was really interesting. And it's really good to see that nothing about us without us reiterated and reflected as well in both research and in practice. Now we're moving on to Denmark, from where we have Hanna Christensen from the Danish Sports Organization and Charlotte Manstrup, who is a postdoc and project manager at the University of Copenhagen's Department of Psychology. And they will speak about the Act, Belong, Commit campaign. So looking forward to hearing about that and its importance in different sectors.
Thank you very much. I think we need to be signed So we can present our own slides and share the screen. And thank you so much for inviting us and putting this important subject on the agenda. So we were presenting 2 different organizations showing co-creation, and also because we think we are better together. So let me start. So it has already been mentioned several times, but throughout many past years, we've seen several surveys saying that mental health problems like stress, anxiety, depression, and loneliness has been increasing both in Denmark and internationally. Just trying to, yeah. But there has been a lot of talking.
Try again. Is this
It,
working?
now it's working, yeah. So a lot of conversation, but not so much action. So back in 2014, me and a couple of colleagues were getting a bit frustrated that no one seemed to be taking any action. So we started looking into the literature to find more information on effective mental health promoting programs. And here we came across a campaign called Act, Belong, Commit, which at the time was the world's first and only attempt to develop and implement a population-wide mental health promotion program, as distinct from mental illness prevention or early intervention initiatives. So we went all the way from Copenhagen to Western Australia, Perth, and Denmark became the first country outside Australia to sign a memorandum of understanding with the Act, Belong, Commit there. And so before we started implementing the Act, Belong, Commit, or the ABCs in Denmark, we did research to make sure that, for instance, the 3 research-based messages could be translated into a Danish context. And it was very important for us to know whether mental health and keeping mentally healthy had the same connotations in Denmark as they had in Australia. So fortunately, the message showed to be adaptable, although we made some changes. For instance, we changed the logo, and we also translated the main messages, Act, Belong, Commit, into Danish. So in Danish, it's called gør noget aktivt, gør noget sammen, and gør noget meningsfuldt, or do something with someone, and do something meaningful. So just to elaborate a bit more on the 3 messages. So act or do something. You can be active in various ways. It can be both mentally, physically, socially, spiritually, and culturally. So it can be things like going for a walk, saying hello to a neighbor, reading a book, meditate, or pray. And the second, belong or do something with someone, is about our social relations and the importance of social relations for our mental health. So keep connected to friends, family, and your community. It can be things like joining a book club, joining a sports team, take a cooking class, or go to community events. And the third message, commit or do something meaningful, is what is meaningful to me is not necessarily meaningful to Hannah. So it can be, it's about finding out what's meaningful to you. So do something meaningful, important, and valuable to you. It can be volunteering, learning something new, or taking on a challenge, or taking up a course, or helping a neighbor.
Yes, and in the ABCs, we use this river metaphor to explain the difference between treatment, prevention, and mental health promotion, and to show how mental health is a continuous process in life. Now imagine life as a river. In one end, the water is low and shallow, and you can easily see the bottom. In this end, we consider people to be mentally healthy and flourishing. They have a surplus of energy and are more likely to be altruistic. Further down the river, it becomes deeper, there's a stronger current, and it becomes more difficult to keep your head above water, and the energy level decreases. In this part, it would be considered people to have moderate mental health. In this part, you're still okay, but struggling to overcome normal stresses in life. When you're on this part of the river, there is an increased risk that you can get caught by the current and float to the even more uneasy part of the river, where the current is so strong that you are having trouble finding foothold, and you do not have any spare energy to care for yourself or others. So people in this left end of this river we can consider as mentally unhealthy, languishing, and some might even experience symptoms of stress. In this part of the river, on the left, you are not far from being dragged down the waterfall where people may experience common mental health disorders like anxiety and depression. So people can be born at different parts of the river, and depending on what resources they have available, they have better or worse condition for staying in the better end on the right when life or bumps on the road hits. So when people have fallen ill, they should of course be treated. And when they experience stress or languishing, we should make sure to prevent them from going down the waterfall to the left. But if we really want to prevent people from going in the deep end of the river, we need also to focus on mental health promotion across the river through life. Protective factors and resources can be found on different levels, and it's very important that all levels are involved in promoting mental health and well-being in the population. So this is why we have this ABC partnership in Denmark, and why it's very important that the partners represent all these different 3 levels.
Yes, we started building the partnership back in 2014, and it's a cross-disciplinary and cross-sectoral partnership because research shows that if we want to promote mental health among the whole population, we need to work across sectors and disciplines because mental health is everybody's business. And the ABC partnership in Denmark now covers more than 80 partners across all of Denmark and includes municipalities, NGOs, private organizations, and us as researchers. And actually, the ABCs have spread also internationally to other countries. But in Denmark, partners work from the same overall goal of promoting public mental health and work from the same overall principles. Because partners have different target groups and no one size fits all, it's important that initiatives are fitted to the local context. The principles and ABC framework is the foundation for all the information and local initiatives that are developed within the partnership and for capacity building. And it's also the foundation for research, collaboration, and knowledge sharing. For instance, we engage all partners for network meetings 4 times a year when we meet up. Yes. And I just mentioned the capacity building, which is a central part of the ABCs. And every partner in the partnership has at least one ABC coordinator, which we train. And the ABC's framework is used to create a mutual understanding of mental health across all sectors. So the ABC coordinators are responsible for the ABCs in their own organization and also for sharing experiences with putting the ABCs into practice and sharing that in the partnership. So they also play an important role in spreading information about both the ABCs in their local communities and to help people they come in contact with to understand and be able to engage in ABC activities. And this can both be done by creating new initiatives and by identifying and communicating existing local initiatives and pointing people towards them. So further, the aim is for the ABC coordinators to help create synergy and collaboration across community centers, for instance, schools, sports clubs, etc., to promote community mental health. And in the partnership, we also produce campaign and communication materials to be able to communicate the ABC messages to the public. And throughout the years, we've developed many different materials and campaigned with different foci. And the materials are communicated through the channels of our different partners in the partnership and also on our own website and social media channels. So you can see some of the resources here, which are all available on our website. Unfortunately, they are all in Danish, but maybe you can get some AI help to translate it. And I think that's what we have to.
Yes. Thank you.
Great, thank you so much. And actually really worth mentioning is that this ABC campaign is one of the 29 best and most promising practices that were submitted by national authorities and stakeholders. They are featured in the EU, in the European Commission's repository, which has a database of projects on mental health and best practices and most promising practices, which are supported by the European Commission as part of the comprehensive approach to take collaborative action across the member states and to address mental health challenges across the EU. So I'm looking forward to hearing more about that in the rest of Europe. The link is also in the chat here, so if you have more questions or if you want more information on that, you can look at that. It's also where you can leave your questions. So if you have any of the speakers you would like to ask a question to or make a comment, feel free to leave it there. We have one more presentation before we get to the Q&A and the discussion part, which is by Dr. Garth Graham. He's the Global Director of YouTube Health. And as information is a determinant of health, we are often dealing with a lot of medical misinformation, mostly on social media and the internet. And people all over the world are using YouTube and other digital platforms to find answers to their health questions. But I understand that Garth is also committed to ensure that quality health information is available and that youth mental health is a particular priority for you. Can you tell us more about who you've partnered with, particularly in Europe, to create and promote scientifically accurate health videos?
Yes, thank you. I'll start by acknowledging, as you said before, that we realize that platforms like ours are a place where people come to for health information, certainly mental health information, and we're part of patient journeys across the world and certainly in Europe. So hopefully I'll give you a sense of kind of how we do that, how we raise up high quality health information and tackle issues around protecting youth mental health in particular. Next slide, please. So the group I'm in charge of, YouTube Health, our role is really this idea of creating high quality health information, working with partners across Europe and across the world to make sure that health information, particularly high quality health information, mental health information, is available on our platform. When we think about the way in which nowadays people get their information about health, a lot of that comes in the form of video. And so people are actively seeking information. And as they're looking for stories and life experience of others who have gone through similar challenges they are, platforms like ours, and in particular, the concept of how you reach people with video at scale is really important. And so we've been working with both clinicians and health organizations across Europe to be able to achieve just that. Next slide, please. So how do you define this issue of what is quality mental health information, quality health information? So we published a series of papers, one starting with the World Health Organization and the National Academy of Medicine, that really define this concept of what's a credible source of health information, including the kinds of sources that would be credible for mental health information. And we looked at really the source as the proxy for the quality of health information, and then use that those signals in terms of quality health information sources to be able to raise up those sources on our platform. And the kinds of things that the World Health Organization used to define quality health information is not just evidence-based, but looking at the concept of engaging and making sure that the kinds of health information that people are creating, particularly mental health information, resonates with the person receiving information, and resonates and is reflective of the overall community. Next slide, please. So we use the standards developed by the World Health Organization and the National Academy of Medicine, as well as others, to lift up and raise up these credible health information sources. And we do that by both labeling the information that's coming from a credible source, coming from a hospital or an organization, or even in some countries, individuals that are licensed medical professionals or licensed mental health professionals as well. And we raise that up in something called the health topic shelf. So if you're looking for information about anxiety or depression, that information comes from these credible sources. Next slide, please. But equally as important is how do we work to protect mental health, including youth mental health, and provide resources that reduce stigma and instill hope. So one of those things in terms of safeguards for teens is this issue of dispersing content that in its individual context may not be harmful, but in repetitive context then may be harmful for teens. So this may be information like around body image or information around social aggression, where just watching one video in isolation is not particularly harmful, but watching multiple videos after another can in fact be harmful. And so what we announced that we're doing, that we do is we disperse that kind of content so that teens aren't viewing them in a repetitive context. We also feature crisis resource support in terms of pointing people towards crisis resources in their local country when they're looking for topics that may be reflective of acute distress. Another thing that we've launched is this issue of personal stories. And so when patients are going through particular challenges, individuals, particularly mental health challenges, seeing someone who has gone through a similar life journey and understanding their journey is particularly important, especially for destigmatizing issues around mental health illness. So we've created something called a personal stories shelf, which is really a way for content around personal stories related to particularly mental health. So we can tackle issues around stigma and reduce the concept of isolation when we think about this broadly as well. Next slide, please. So to conclude, you kind of see our overall strategy of both raising up high quality content on our platform, but also dealing with addressing challenges around pointing people to resources, as well as challenges where there may be content that may not be positive in terms of youth mental health. And there are other things we've been doing around removing content around eating disorders and related content, again, that may be challenging in particular for young users. But I'll stop there so we have time for Q&A.
Amazing. Thank you so much. And I really appreciate this emphasis on WHO information and fact-checking in health information sources, as especially for youth, it's arguably even more important than medical professionals, where they seek help is mostly online. So things like the crisis resources and the community support are really important. If there are no questions right now in the chat, maybe we can kind of link this to Carl, who also focused on the need for science and data when it comes to informing policymaking as a takeaway from the AI project. Maybe Lelia could comment on this from a WHO perspective to kind of show the other side of both the YouTube Health project and the AI one.
Sorry, Belle, I disconnected. Can you please repeat the question?
Yes, of course. Mom. So the focus on science, data, and evidence to inform policymaking, as we both saw in YouTube and the AI project. Could you comment on that from the WHO perspective?
Certainly. And thank you so very much. This has been a very rich discussion, and thank you also. It was amazing to hear all the inspiring projects, but also about how YouTube is approaching health. And thank you also to YouTube for being so firm into maintaining credibility of scientifically proven data or evidence displayed there. Of course, for us in WHO, data and evidence are the driver of all actions and all policies and all that inform all initiatives. Unfortunately, the evidence and data is not always there, or if it is there, it's not always of the highest quality. And that brings us to, and also we have to remember that the scene of data and evidence that is available for public use is very patchy. Some data are produced by, for instance, governmental organizations. Some data are produced by specialized research institutions. Some data are produced by aspiring researchers. And then the quality of those data do not only depend on, for instance, the competency of the researchers, do depend on the funding that made available for the said research, but do also depend on the sophistication of the data collection systems. And data collection systems, especially those routine data collection systems, are not even, are not the same. Even within a country, you have different levels, different quality of data collection systems. Now, why I'm making this preamble is to make us all understand that sometimes us who are, those among us who are going to look into data, find some research that is not very good quality, and then we get a bit upset about why there isn't a better quality of research there. But there are a number of reasons why the data that we have at hand are not always the top quality. So I try to explain only very few reasons, but there are more. Now, where does that leave us? That leaves us to a moment, there are two moments that where this brings us. One moment is that the credibility, when the credibility of data is compromised, then there you have all the conspiracy theories around. So one bilateral, one collateral damage of the poor quality or absence of data is the conspiracy theories, as we have seen happening around, for instance, COVID-19 and so on and so forth. But another, especially for us in WHO that are the policy making seat, working with our member states, very often a lack of data justifies lack of action, which is indeed very unfortunate, because we might not have, especially when it comes to, for instance, a proven effectiveness, a documented effectiveness of a certain intervention. When we do not have sufficient data on that, that doesn't mean that this is a pass for you to not take action. If you are in the seat of someone that is tasked with the responsibility of taking action, you have to find a way of taking that action. And just hiding behind lack of data or behind poor data is not a good justification. Because on the other hand, I want us to remember that while we may not have, for instance, very good data about a certain intervention, no? We certainly have plenty of evidence about what does not work. There is so much evidence about what does not work, what has failed, what is violating rights of people, that we do not need, that this should serve as a sufficient impetus for taking action. And this is this is something where we need to find the balance. We walk in a very thin balance here. And I know that some people are probably not very much in agreement with me, because then they are trying to insist that we need to have very, very solid data. But in the case when very solid data are not possible to be produced, then what do? Co-creation, take co-creation. We still do not have a body of very solid data that are relevant for the entire world to justify, to prompt policy action. But the data we have are sufficient enough, and the awareness we have that co-creation is indeed, in addition to being an effective intervention, is also a human rights issue, then this is enough to be an impetus for action. I hope I responded.
No, that was very insightful. Thank you very much for that. I hear Stefan also has a comment to add to this.
Yes, thank you very much. I just wanted to raise your attention again to the fact that the European Commission, we are actually trying to contribute to better data. I said already, as of 2022, the European Health Interview Survey will include additional data on mental health to measure the level of subjective well-being of the population. In 2027, the EU survey gathering data on income and living conditions will include a module on mental health to support the monitoring and assessment of progress on mental health across the EU. Yeah, we are aware that this is still not ideal, and it's only in 2027, but we are making an active contribution to better data here.
That's incredible. Really great to see. We have one more question from Jacob Schauenburg to Hannah and Charlotte. Can you share some practical examples of how the ABC project was implemented in local sports clubs?
Of course, and thank you for the question. So in DTI, which is a Danish sports organization for all, we have operationalized Act, Belong, Commit, or ABCs of the mental health by looking around our activity. So we are not focusing on the specific activity, for instance, football. We are looking around in the environment and especially focusing on the social aspects and small actions that can create this feel-good surrounding that may help people thrive and stay in our sport communities even when they're feeling down. So the way we have operationalized it is by working with a warm welcome, for instance, by having more welcome hosts, taking good care of people coming inside the sport community, and working with a better cohesion and community culture by building up a better capacity for our trainers and instructors so they know how to build a sense of belonging and commitment in the training. So it's not only focused on the activity, but also a really good environment for all the members. I hope it was an answer to the question. Do you have anything in the supplement?
I think you explained it very well.
It's perfect. Thank you. It was clear. Carl has his hand raised, so I'm giving you the floor.
Yeah, sorry, I just wanted to jump in very, very quickly. Just in response to exactly what Lydia was saying, and also what was said after by Stefan Schreck, I think that's exactly the point, because there isn't enough, sort of robust data, or the data is patchy, or that it's going to take a while. And we know that AI and technology is just moving at the speed of light. That's exactly why these sort of interventions with co-creation need to happen sooner rather than later, so that when you are going up to the developers who maybe don't understand how stigmatizing these sorts of things are doing, that you say, okay, yes, it's great that you're training algorithms to do X, Y, and Z, but you need to be putting in caveats, right? You need to be putting in caveats that are exactly kind of similar to what Garth from YouTube was saying, that it's only utilizing well thought out, non-stigmatizing material. And I know it's sort of a bit of a paradox there, because the only reason that they can get so much data is that they throw to kind of use an analogy, they throw the fishing net wide. But at the end of the day, if this is just meaning more stigmatizing sorts of things, I think that's why co-creation is more important than ever. You need people sitting at the table to say, right, put these sort of caveats in. Anyway, that's all. Thanks, Bill.
Brilliant. I think that's actually a really great note to end this short discussion on. Thank you for all of your input and your questions as well. We're slowly coming towards the end of the webinar, but the European Mental Health Week obviously continues till the end of the week, and mental health in general continues to be a very important topic, especially for those living with mental health issues. So now we're turning to Claudia Marinetti, who is the Director of Mental Health Europe, and she'll have a short note on what she's taking away from today's webinar.
Thank you very much, Belle, and thanks to the European Commission and WHO and all of you for being here today. So Belle mentioned European Mental Health Week continues, and you will soon find a link in the chat on other ways in which you can engage for the rest of the week. It's been a very exciting event, and I found very interesting all what was discussed. I've heard about all of these interesting initiatives. It's great also to hear about the advance that has been enabled by the communication from the European Commission. And I also share with Lydia the fact that it's amazing how much it has happened, and some things like co-creation not even being discussed at all just a few years ago. So this is great. But of course, we should not forget that there are needs that still are unmet, that the lack of trust and buy-in in public health systems, in mental health systems, is still there. And that also means that there is a lack of cohesion in our societies. And that is also why it is very important, the topic of co-creation. It really encompasses all of our actions as a society. And so business as usual won't work. There are, of course, some solutions. Co-creation is one of them. Also because it does bring in accountability, a sense of responsibility. If you are involved, you are also accountable. You will also have the responsibility to make things right and make things work. I think that progress cannot be taken for granted, and we need so to be careful and to make sure that there is commitment also in the future around mental health. And we all have a role to play, and this is really important. All of us here, we need to work together, and together we can create even more of this movement towards improving mental health, so that in the future everybody can enjoy good mental health and can also, of course, enjoy their rights. And just close very, very briefly, because I want to thank all the people in my office that are behind the European Mental Health Week and all the work we do. Okay, Francesca has already spoken today, but there is also our communications team that unfortunately is not seen, so you don't know, but they're doing really, really amazing work. So Alexandra Latham, Margie Marchetti, Jose O'Sullivan, Jackie Millese, and also our policy colleagues, Camille Roux, Fatima Rawil, and all the rest of my colleagues that have been working really a lot to make this happen. And I'm really, really grateful to them. Thanks.
Thank you so much, Claudia. Then we have the final words for our host, the European Commission. Stefan, what note would you like to end today's discussion on?
Yes, thank you, Belle. Colleagues and friends, as we wrap up this webinar on increasing mental health understanding, awareness, and acceptance, I would like to thank our speakers and participants for your time and insights in today's discussion. Mental health represents one of the major global public health challenges in the 21st century. As such, it is a top priority for the Commission, as well as our colleagues from Mental Health Europe, and as we heard, also WHO. If we want to lessen the burden of mental health and promote mental well-being across the EU, we need a comprehensive prevention-oriented approach. And together, I think this is an achievable goal. Today's discussion has brought to the forefront the importance of working together on an equal basis and according to a human rights-based approach. Mental Health Europe and WHO have described how co-creation provides added value in improving mental health and highlighted that it is indeed possible to ensure engagement and dialogue with all relevant actors. We have listened to inspiring projects. The communication on a comprehensive approach to mental health provides the strategic framework for support to EU countries in delivering mental health systems and services that are based on the principles of co-creation and human rights. The communication calls upon all relevant actors and stakeholders to work together towards the same objective of improving mental health. I also want to express gratitude to Mental Health Europe for their efforts in advocating for mental health awareness and support. Their work has been instrumental in advancing mental health initiatives and promoting mental health in communities, focusing on vulnerable groups and creating an inclusive environment for individuals facing mental health challenges. Similarly, we are collaborating with WHO Europe to support member states in building capacity on mental health by strengthening mental health systems. We will continue to work with member states through the expert group on public health, as well as our external partners, to make our shared goal, better mental health and well-being for all, a reality. Thank you very much.
Thank you so much. And I'm afraid this is all we have time for. So thank you all for attending and joining us on this webinar on co-creation in mental health. I think this event in itself already shows that this is an increasingly important topic, and it's now also a very critical part of decision making. So the nothing about us without us is really turning into a practical approach. So let's continue these discussions and the cooperation so we can increase mental health understanding, awareness, and acceptance. And I wish you all a great day and great mental health week, and take care. Thank you.